Well, welcome and thanks for joining us today here. And I guess I haven't done a press conference in a while, so it's good to see everybody. I'm Matt Woodson. I'm the Commissioner of Education for the state of Nebraska, and obviously we're in an opportunity really to re-examine the health and well-being of our students across the state, and part of that work includes the health standards that have drawn quite a bit of attention over the last several months. And so what I want to highlight today is we are releasing officially a draft number 2 of those particular standards, and we've taken very seriously the public input that we've received from individuals, from parents, from organizations, from many people across the state, and we've received that public feedback in our regular expected public input processes. So we've had surveys, and we've had emails, and we've had the opportunity to hear from folks in public meetings. I think really obviously important with the health standards is they actually cover a broad area of health-related topics for our students, which I'll talk about in a little bit. But obviously, the things that have drawn some considerable comment have been around anything related to sex education and the importance of how we balance that topic, that important topic for our students across the state of Nebraska. And so our draft 2 is available now on our website. You can actually download that and review that. Still up on our website is actually draft 1, so people can see the differences that have been made. You can certainly do that. We're welcoming further public comment on this second draft. Very important to the State Board of Education, to the Department of Education staff, to the folks that have been working so hard on this, was really to listen and hear what public comment and what other input we were receiving. And really by design, we wanted to intentionally include those comments and some of that information for our parents, our school leaders, and others. Recently, we certainly heard a lot from our school leaders about how they would like to see this balance and their role as part of setting the expectations for students across the state. And so as we've received those comments, it's been important for us to really listen to our schools too and say, here's how we think we can do this best. And so again, the standards that we have released now really remove many of those topics that were considered a little bit problematic for people in across the state, the types of comments that we heard. But really what we want to focus on is ensuring that our parents and guardians and everyone, every trusted adult for our students are engaged in the process at a local level. Now, many of the standards that are across the health standards overall are certainly our foundations of personal health, nutrition and physical activity, substance abuse and prevention, disease prevention, injury prevention and safety, social, emotional, and mental health, and human growth and development, and then consumer and environmental health protection. So it covers a broad swath of the expectations that schools have. There are requirements in the law that schools offer health education. It's part of the requirement that we expect that schools do and provide. From the earliest years to just talk about the safety and well-being of our students all the way through high school to make sure that they're prepared for the environment that they're going to enter into post-high school. So it's really important that we're able to provide leadership in that space broadly like we do in all content areas. We have been asked before, it's like, well, you don't have to do health standards as a state, right? This is our first time to try to adopt health standards. Standards themselves are ultimately a common understanding of what the expectations are for students across our state, right? And that's a partnership already between the Department of Education and our school districts, our educators across the state. But increasingly, it's very obvious that we have to make sure that we are able to fully engage our parents, our communities in what these topics are. So when it gets to sex education, it's really important that we're able to do that and do that well. So many of the topics, many of the strands, or many of the goals within this are still there, but the goals are ultimately that we have a solid partnership with parents and schools, and ultimately that conversation happens in that way. So many of those topics are removed. Now, people can look at this and realize that there may be elements that some might consider sex education. The importance of puberty, right, is one of those things that still remains in these standards. The importance of prevention of sexual assault, the importance of the prevention and protecting our children from things that they need to know, the importance of understanding how to be safe from disease, All of those things may end up in the standards, but they are not explicit. What we're asking schools to do and working with their communities is ensure that they can actually develop a curriculum ultimately that meets the needs of their students and meets the needs of their communities overall. And so I just find it really it's been a critical part of the conversation, an intentional part of the conversation to figure out where we should sit and how we should best lead from a state agency perspective, from a state board perspective. Just in my own personal role, I'm a parent after all, right? And so as a parent, it's really important that parents have that individual connection to their school, that they're part of that process, that there's always good conversations back and forth, and that remains the intention of this particular work. When we started this process, clear back in August with the state board, we talked about what these purposes were. We really outlined a time frame that would include releasing the draft in the spring, getting to the point where we'd have a second draft. There's always that process in our standards overall, that we take that public input and engage folks. And so that's what we've done. And obviously, many times we'd ask, how do we get more public input? I think we found a way that we got more public input this time, but it's actually good. That's what we always hope for, and that we hope to have folks engaged in a meaningful way. And again, I think this will be people will perceive this as very responsive to what their concerns were. Our next steps will include ensuring that we can continue to take that public comment. We'll have a state board meeting next Friday, where certainly public comment will be part of the process. We'll present this and present the second draft kind of to the board for their discussion and their opportunity to discuss where the state standard, where the health ed standards are currently. And it gives us a chance to kind of reflect. The board as a body, when they meet, they have that chance for that dialogue, and this will give them a really good opportunity to do that. We have to do that, and then certainly we'll take more public comment at that point in time. The survey is open on our website already. I think we have a kind of a standing email that folks can submit comments. I think we're already receiving comments, and so we welcome that. These never within a standard rate process do you actually please probably everyone in that approach. It's going to be important for us to take additional feedback, respond to that, come out later at a time and make sure that we can articulate what those things are. But again, I believe we've done a very thorough job of understanding what the public had said, the feedback that we received, and really now our work is how do we balance the important role that we have, the important role that schools have, and the important role that the parents and families have in these conversations. So with that, I'll stop and certainly take your questions. Again, thanks for being here today. Yes.
Hi.
And I wish I knew everyone's name, so if I point at you, sorry, I'll just do it that way. So.
That's okay. I'm Isabella with KMTV. One of my first questions, when you were coming up with the second draft of releasing the health standards, what were the most noticeable changes, especially coming out after this pandemic with the Delta variant out there that you guys made?
Yeah, so I mean the health standards overall, and I don't know if the questions are picking up, so I'll try to repeat it. Since in the midst of the pandemic, what were some of the other kind of concerns with this? We were very worried, and I think remain very worried about the impacts on our students as a result of the pandemic. Academically, we're worried. I mean, we know that this has been a challenging time. We know that we see data and results, not just in Nebraska, but across the country on how that's hurt our reading or math or any of those things. But we also know that personal well-being is part of the challenge in this particular moment. A lot of fear and concern about health overall, and then mental health, right? We're worried about how families are doing and how they're managing in the pandemic. Economic stresses and all the stresses that folks have felt are important, and it's really also very important that schools are able to have that conversation with students. Their students are coming to them saying this is a unique moment in time, how do we have that dialogue? And so we're trying to equip both schools and the system as a whole to be able to engage in a meaningful way, and that certainly did settle into this work as well.
Zach with Drone Star. There might be some that say this draft takes away key provisions for LGBTQ students. How would you respond to those concerns?
Yeah, I mean, definitely. And so the question was that, some might say that it takes away key provisions of LGBTQ and other students. The state board's been really vested in ensuring that every student can see themselves in these standards. And one of the things, and one of the barriers I think that ends up happening is beginning to mention whether it's LGBTQ or students of different races or students of with different ability levels, right? It's important that every student's able to do that. Perhaps that doesn't best happen in our health standards overall or any of our standards, but it's actually in that relationship again at that local community level to ensure that we can do that. We want to make sure that schools are finding productive ways to do that. We want to make sure that communities are having productive ways of having those conversations. It really is important to continue those conversations, but to be able to do that in an appropriate way at our school community level. Yes.
One of your standards, I believe it's in the 7th grade, it says recognize biological sex and gender identity may or may not differ. Can you give more detail on how that would be taught or implemented?
And again, when we write a standard, the intention is that they're able to, that our school, curriculum experts are able to kind of look at that standard and say, here are the best ways. And so we'll obviously continue to take comment on how that's done. Obviously, there is an important notion of making sure that every student can see themselves in these standards. And the importance of what we look at risk behaviors for our students from various surveys, making sure that students all can see that they fit into the conversations overall. So I can't describe exactly how that's going to look because that's not really our job to describe how it looks, but I do think it's going to be important that at a community level they're able to have that conversation between schools and parents and the students themselves.
So, Commissioner, one of the standards that was in the first draft that has now been eliminated was for third graders to demonstrate, promote and demonstrate respect for the dignity of people of all genders, gender expressions, and gender identities. Does the elimination of that mean that that's no longer important?
So the question about whether or not removing the third grade standard on respect for others, right, in general, right? I mean, we're always going to be talking with our students about respect for others. I think the challenge within the standards is some folks take that as, hey, look, this is explicitly how that has to be delivered. To that very point, we're always talking, and probably across curricular areas, and just the engagement with students overall. Teachers work very hard to ensure that our students are fitting into their classrooms, making sure that they have respect for one another. I'm sure we'll have more conversations about it, but that absolutely still does matter.
Andrew Ozaki from Channel 7. What about schools that are already had implemented some of the things that you have had in your first draft? Are you telling them that they don't have to do that anymore? Should they strip that out of their curriculum?
So Andrew's asking because if we take certain things out the schools are already providing for their students, then they have to respond to that, right? Do they have to do something different? And the answer is no. Actually, the standards as we adopt them here are really to help provide a role for those places that maybe are looking to make sure that they have an expectation and a balance with what the state expectations are, but there's not a limitation on schools. But in fact, we encourage schools to look and build on standards overall. It's important that they, just like on curriculum, that they have these conversations at their local level. They've done that work already and have included that in their curriculum. They've largely done that work with their local community and made sure that this was appropriate.
Camry Sill from 1011. Did you guys expect that controversy that you got in the beginning?
So Camry asked if I expected the controversy, and the answer, me personally, no, right? I mean, I think part of it is it's unusual for us to get this much attention to our first draft of standards, right? Our process is really designed to certainly get that public feedback. There was a lot of public feedback, obviously, early on. And so it's not that we expected that. We know it's also it can be a sensitive topic in conversation. In part, the reason that we wanted to make sure that we're doing it is providing some leadership for schools that also want to be able to find the best way to do it. I don't know if we designed the best way. And so we're going to continue to work with our schools to ensure that they can have those legitimate conversations. But we certainly didn't expect the level that we've witnessed.
Second question for you. When you guys include or remove certain things in these standards, why did you all feel like it was important for the education aspect to take that over rather parents just including it back at home?
Yeah, I think there's some balance, right? I mean, so schools and our students face many different types of challenges in their lives, and schools are asked many times to help solve the challenges that may be faced. And so we felt it was important to at least be in the dialogue around standards that there are certain things we're always going to say to a school and to a community and to the parents. We need to have that dialogue. This was never intended to stop that dialogue from happening. But in certain circumstances, our students may not have the same family structure. They may not have the support. We have homeless children that attend schools in the state of Nebraska. I don't know where we find that and strike all of those right balances, but we believe schools have to be part of that support system for our students.
And one more, do you have an additional message for parents that are still on urge about certain standards that you guys have still decided to include?
Yeah, I mean, any of our parents out there, right? I'm going to say it to parents, I'm going to say it to schools, I'm going to say it to communities at large. Part of our work is actually together, right? If we stand divided about how to serve our students best, we're going to always be in trouble. Instead, we need to find those things that unite relative to serving our students best. And I think as parents, like, do you know your teachers? Do you know your principals? That's always where I send people when they start to have a challenge at a local level. It's unlikely that for my position at the state that I can help someone over here so specifically, but it's that relationship between the schools and the parents and the students that are going to make the big difference. So parents should know that this is an empowering part of the conversation. We want them engaged, not just on health standards, but in math education and science education and social studies. And we want to make sure that we're able to not just message that, but really live that. And I think our schools do a great job of that. So this has been happening for a long time in Nebraska. It's our friends and our neighbors that are teachers and administrators and school board members. And having those conversations at that closest level to their children is always the best way to go.
What were your conversations like with elected officials, specifically the governor, when you were outspoken about the sex ed guidelines?
Yeah, I mean, definitely, we've heard a lot, right? So we know that we had formal letters that went back and forth and those types of concerns. We did really try to listen, just like we listened to other public comment. And, elected officials, are going to always be able to try to bounce ideas back and forth. Again, in fact, there was legislation, right, that is introduced that was with the intent of decreasing child sexual assault. And part of that was going to be put on us, or put on the department, put on the education system on how to do that. I think we have a better understanding of how that can be balanced. I've specifically spoken to the governor. I know what his concerns were with the first draft. I know as he's kind of communicated just overall across the state what those concerns were. I believe this draft not just addresses those concerns, but puts us in a position to actually have a dialogue that takes place at that local level. When the state says you shouldn't do something, it's also in a top-down approach to let schools make decisions at a local level. And so I think that's a balancing act that Nebraska has historically done very well. And my concern always would be if you say school should not teach X, Y, or Z, that also diminishes the local role. And I think we got to find that balance in Nebraska.
Matt, how will you?
Two more questions. What are your?
No, I'm sorry.
Oh, he has some back there.
Yeah, sorry, this one's actually related to that, so I thought I'd jump in. Joe from World Herald asked, who else did we consult with? There was some concern that we didn't consult with enough groups in the first draft.
Okay, yeah, and also a great question to add on. I mean, there were a lot of folks, obviously, that we took in public feedback. We had formal letters from school districts. We had feedback from a lot of different groups. And so we did try to make sure that we were looking specifically at that, if they're representing a viewpoint that helped us understand how to make our standards better. So our non-public schools, and I think specifically the Catholic Conference from Nebraska, provide us really good insights to how they would actually approach this from their perspective. And it actually it's not terribly different than what we're talking about in working with our public schools, right? You want your community of interest to be included in those conversations. And so those were really good opportunities for feedback. I know that we had other groups that were represented that we looked specifically at the guidance or the information that they provided, our groups that were representing families and otherwise, and we wanted to make sure to have that included. And so I actually think there's language that came from some of those particular groups that helps us improve the standards for us.
Certainly a lot of these changes did come about through that feedback, be it from individuals, groups, or elected officials, but did that feedback bring about any possible doubts, questions internally when reviewing this for the second draft?
As far as that feedback, I mean, I don't know, maybe the best way to put that, right? I mean, it did impact us relative to the things that are important. But when we try to look at the whole scope of how to have these conversations, I think really paramount in the messaging that we heard. People could talk about the specific things, but they also said what's most important is that you have that relationship with parents and caretakers and families as part of that structure. And so we were very intentional to understand that was a concern and then be able to help schools navigate that as part of our hope certainly now as we go into it. But yes, it certainly had an impact on how we looked at these standards.
Do you see this draft as a way to hit the reset button and kind of move forward with the process?
Yeah, I do think this draft gives us a chance. Folks need to find common ground. This is a very divisive time, across a lot of different topics. Our students are going to be starting school this fall, right? And we've had a lot of distractions relative to that. So I do see it as a reset. It's always been our intention that we have this chance to have a real good conversation among policymakers and adults that are driving community conversations. But as our schools re-enter this fall, it's important they're able to focus on the rest as well, right? So finding that balance, doing this right, we're not looking to rush decisions, we're looking to make sure that we do it with a sense of determination about ensuring we're doing what's best for our students in the state.
Some of your critics said, don't revise them, just scrap them. What's your response to that?
Yeah, we definitely have folks say just scrap them, and I think, I'm not always sure that they've actually dove into the rest of the standards, right? And I think that kind of changed over time. A good example, actually, in the conversations with the governor, I think that was kind of his first thing was just scrap sex ed standards. In my conversations with him over time, well, there are things that are really important that schools are able to do, and I think that evolved a little bit over time. There are certainly still going to be folks that just say, just scrap standards. I might have people say that about math, too. It's our responsibility to provide some of that leadership, and we'll continue to do that.
Now, what do you tell the students that don't feel like they fit in, they don't feel like they're getting support right now, and they're hoping that maybe these standards might help them?
What I would tell students that feel like they can't now find themselves in these standards, I think is always important. I think every student going through school at some point or another feels a sense of being, I don't know if I fit in, I don't know if I do this. The important part is actually a system of structure. Standards will not solve all of those issues, right? What we need is a structure within our education system that supports students where they're at academically, whether socially, whether emotionally, wherever they may be. It's a support system for our students to raise our children collectively in the state, to be able to do that with parents. We're going to have those challenges whether we adopted these standards or not, right? And I think the important work that we're going to have to do is continue to work with adults to understand those students that might be left out. I'm always very worried, back to the pandemic issue, very worried about where students are emotionally. When we see suicides across the state, where we've seen really damaging types of things that might happen for students. Those are all real concerns that are hitting our classrooms, and teachers are needing the support as well on how to best support their students. And so we'll be able to continue much of those conversations, but it's setting a set of standards doesn't solve all that for our students, and we want to make sure that we find out ways to do that.
And some people say you cave to political pressure. I mean, why did you change this?
Yeah, so I understand. Some people say we caved to political pressure. I just want to go back to the notion of what we're really trying to do is understand what Nebraska as a whole accepts as a standard and an expectation of what our students learn in school. There's always going to be a little bit of tension over those types of issues, and especially in this sense. But I think it's not about whether or not the politics move us in that direction or not. It's that the politics reflect the conversations that we have to serve our students best. And finding that balance is really going to be more helpful to solving that and addressing those types of issues for our schools and for our communities and for our kids than worrying about whether I cave to political pressure or the board does. It's about this balance of understanding what the state really needs to accomplish, how we can provide leadership, and how we can ensure our students do and have what they need to be supported.
On COVID, what's your reaction to the CDC recommendation for masks in schools?
Yeah, can I pause there for a moment, just because I saw David say he had a question, so before I switch topics on this.
Right, one more health-related coming from Jessica from the Grand Island Independent. Was there a noticeable difference in the nature of feedback received from people and groups in smaller districts versus districts with larger student bodies, and if so, how?
I don't know that we analyze the differences between the feedback from smaller places or other. I do know from what I'll call just my conversations with leaders are differences in how folks in school districts have taken on these issues. It's part of the beauty of Nebraska that we actually have and allow for those things. I think in smaller communities we saw that, hey, look, we can take care of this ourselves to a certain extent, maybe in a general feedback sense. But maybe more important is that they didn't want to see something that was top down. I think in larger districts, they have more capacity to try to think through how they might handle it at a district-wide. It changes how those conversations might happen at a local level. I don't know if I could strictly say that there's a lot of difference in that feedback overall.
And then I would ask, anything else on the health standards before we move on to other topics?
Can you give just a quick description of what's next in the process of this draft?
Yeah, so then the next part of this process, obviously, the feedback loop is open, right? Folks have a chance to go and fill out the survey and provide us additional comment. When we meet next week with the state board, we'll have a presentation of kind of some of those next steps, but realistically, we'll be looking at that taking comment for a period of time. We haven't set a time limit on that just yet. We want to hear what folks have to say. Eventually that additional feedback will result likely in a draft 3, so I don't think that this will be the final draft that the board would vote on. There'll be some more feedback that we will take. And then, if I was to say, I would hope to be able to adopt standards yet this fall, but we're not going to set a hard timeline on it. And I think the soonest that we would even be ready for that if everything fell together would be October, but October, November, if there's a chance to do it in that time frame, that'd be ideal. Fred, I'll come back to you. Question about the CDC and masking or the changes in there, kind of.
Aren't they recommending that all schools require masks?
Yeah, really what CDC now is recommending, not just all schools, but vaccinated or not, I think under most circumstances for everyone that's participating in schools would be masks. I mean, obviously, we're very worried about where the Delta variant, what that type of impact will be. The way that we will continue to handle, just similar to what we've done over the last, however many months we've been in the pandemic, year and a half almost. The reality for our schools, we're asking them to work with their local public health officials, try to balance that out. We didn't strictly follow CDC guidance. In fact, our guidance was out ahead of CDC guidance in last summer, and we wouldn't have gotten open if we had strictly followed that particular guidance. And so I think we're in this mode, and I'm really going to be asking schools to balance those things. What's the level of virus spread in their communities? We're going to have to watch carefully what's happening among our students, and I think obviously a lot of concern with our unvaccinated students, and especially those that are not yet eligible, those that are under 12, and ensuring that we're watching that. I think we'll see, again, statewide, masks are always an option for students and families. There's not going to be a restriction, obviously, on that side, or at least I would hope that there would not be any type of restriction on that side of the equation. The other part is as our schools kind of come back in and we know about vaccination, ensuring that we continue to say that getting the vaccine is our best strategy, given this current point in time, that folks, the more that we have vaccinated, the better off I think we'll feel about a school year, and the better off that I think everyone can feel about the environment that we're in.
Commissioner, just one more question did come in via our Zoom chat. Any plans to encourage or even require enhanced training for school staff for any student who may have concerns that they can't discuss things at home that might be troubling them?
So, yeah, the question around additional training, I don't think at this point we've had those types of conversations, but that's always part of the needs of schools to be able to, we have, like, for instance, and I'll just say a shortage of counselors. We probably have a shortage of teachers statewide right now relative to a lot of different topics, but helping ensure that our teachers feel well equipped to deal with the circumstances that our students face is always going to have to be part of that
Okay, great.
All right, again, just thanks for the opportunity, and thanks for coming and seeing the new place here too, and appreciate your taking some time to